Dr. John Torres on his Facebook Live talking about coronavirus, talking about the pandemic, and particularly talking about headlines you might have heard over the last week or so. Getting behind those headlines so you have a better understanding of what they mean, not just for you, but for your family, your loved ones, and your community, and hopefully giving you some information you can walk away with that can help you keep safe and help get this pandemic under control sooner rather than later. The headlines, again, we'll get behind the headlines, and then I'll answer questions that you might have. So if you have any questions, please send them our way. I'll get to as many of those as I possibly can. But first, let's start with the headlines. And probably the biggest one you might have heard over the last week or week and a half or so are the vaccines and how quickly they're progressing and when we'll start seeing vaccines being given to people. Now, if you think back February, March timeframe, Dr. Fauci in particular, but a lot of experts were saying we're probably going to get a vaccine in record time, 12 to 18 months. Fast forward, that would have been February of next year through the summer of next year when we start getting the vaccine. But over the summer, we started hearing more and more news about the vaccines. There were some great steps forward, a few stumbles and step backs, but overall it kept progressing and progressing. The big concern with a lot of people are, were we going too fast? And that's causing some vaccine hesitancy, which I'll talk about in a minute. But talking to experts, looking at all the information, what they're telling me is we're not necessarily skipping steps. As a matter of fact, we're not skipping steps at all. Instead, what we're doing is we're compressing the time frame. Back in the old days, we're talking before COVID, essentially the way these would work is they would take 10 plus years to get a vaccine to the market, to get a vaccine to get FDA approval. That was so long because they would basically develop the vaccine, which would take a while, and then once they developed the vaccine, they would start testing it. First phase 1, first animal studies, and then the human studies, phase 1, 2, and 3. They would do phase 1, and then they would spend a lot of times, months, maybe even years, poring over the data, looking at it again, deciding what they want to do, and then starting up phase 2, and then doing the same thing there and starting up phase 3. So you can see how this would progress very slowly. When they went to recruiting patients, they would have a difficult time recruiting patients because there really wasn't much of a word out there as to what was happening. People could certainly go to clinicaltrials.gov and look at the clinical trials that are going on. Otherwise, they had to go and try to advertise as best they can, get doctors to ask patients for different, if they want to be involved in these trials, and they would go with that. And it would take years to do, and then they'd seek approval once they got through that. So instead, they've compressed that time frame. As you well know, there's been so much information and so much news about the vaccine that they have not had that difficult a time recruiting people. And these trials are doing 30,000, 40,000 people they're trying to recruit. And so, again, it's one of those things that they are basically being able to compress the time frame and get those vaccines out sooner rather than later. They're not compromising safety at this point. And I think a couple of things that went on can give us a good understanding of that. The vaccines, for a while there are 200 plus vaccines around the world. They're still in development. There's 4 or 5 major ones that are leading the race. And of those, the 2 big ones right now, Pfizer and Moderna, here in the U.S., are the ones that have put down paperwork to try and get emergency use authorization. Now, for those that don't understand this, there's a difference between the FDA giving an emergency use authorization and the FDA giving an approval. An approval is a permanent approval for a medicine or a vaccine. And that takes years and years to do. An emergency use authorization is a temporary authorization to use the vaccine, and it's used in times of emergencies like the pandemic. The reason it's used is because the pandemic or situations like this are causing a lot of complications, a lot of deaths, and they want to make sure they get something out there that can help keep it under control. And so they do a much quicker process to get that, and then eventually they look at the approval process. And so does that increase the risk? It depends on the vaccine and how they're doing that. But in this case, it's getting a lot of scrutiny. And so again, that safety is one of the most important things. A few weeks ago, I actually interviewed Dr. Stephen Hahn. He's the commissioner of the FDA on a Facebook Live series I do called Doc to Doc. And on that series, ended up talking to him, and he made a promise to me. He said, promise to me and the American people that he would not let this go through authorization unless he was definite that he had all the data and that the data showed him it was safe and effective. Once the data showed it was safe and effective, he'd go ahead and let it be authorized. If he didn't get enough data, he'd go right back and ask for more data from the company. So looking at it, here's the way things have panned out over the last week or so. Both Pfizer and Moderna have pushed in their paperwork to get this emergency use authorization. Now what happens is the FDA reviews that emergency use authorization, and people are concerned, like, why is it taking so long? Well, one of the experts put it in perspective. He said the emergency use authorization, essentially, if it was printed out on just pieces of paper, it would be enough pieces of paper to basically go from the street level to the top of the Empire State Building. That's how many pieces of data are involved in this process. And so they're going to be going through this. There's a committee, an advisory committee the FDA uses called VRPAC. That VRPAC goes ahead, the FDA looks at the data, the VRPAC looks at the data, then they get together and they interpret the data and ask questions about it and dig really deep into it. If they can't get their questions filled, then they go back to the manufacturer for more information. Now, on top of that, there's a second committee the CDC has called ACIP, the Advisory Committee on Immunization Practices. And that committee decides who gets it and when they get it and how it's distributed. So, looking at the two systems and how they work, the FDA authorizes the vaccine. The VRPAC, which is the committee for the FDA, advises the FDA and says, yes, we think this vaccine should get authorized. The FDA then authorizes it. They won't give vaccines to people until the CDC comes through and with their ACIP, that advisory committee, says, here's who should be getting the shot, here's how much of the shot they should be getting, how many doses, and here's how to distribute it. Once they advise that, then the CDC signs off on it. Then people can start getting shots in arms. And so you can see the process takes a little while. Usually what happens is VRPAC and FDA meet, they give this emergency use authorization. Let's say in Pfizer's case, they're going to meet December 10th. Thinking is December 11th or the 14th, 15th, over the weekend, then they're going to go ahead and give it that emergency use authorization. Usually what happens is once they do that, within 48 hours, ACIP, the CDC's advisory committee, meets, and they go ahead and allow it to be given at certain dosages to certain people. And then people start getting shots in arms. However, because of the way the system's working here and because of the pandemic, they're to a certain extent jump-starting the process a little bit. ACIP met this week, and what ACIP decided was we're going to decide on who initially gets it. Not just phase one. If you remember, there's 4 phases of distribution, but phase 1A. In other words, who is the top of that first phase? And what they decided earlier this week, and the CDC, Dr. Robert Redfield signed off on it, is that the first people to get it are going to be healthcare workers and those in long-term care facilities, because those are the ones at the highest risk of getting it and getting complications from COVID. And so they want to make sure they're covered. Then ACIP will go back later and meet and decide who's going to be in phase 1B, phase 1C, and in phase 2, 3, and 4. But right now, because of the dosing that's out there, they want to get it to people as soon as they can and make sure that those that need it the most are getting it. So ACIP has met, they fulfilled that criteria. Now VRPAC is going to meet, and they're going to decide both on Pfizer, December 10th, and on Moderna, December 17th, if they're going to authorize it. They'll recommend that to the FDA, and then the thinking is the FDA at that point will give them both the emergency use authorization. Once that happens, since the CDC's already signed off on it, then they'll go ahead and distribute it and getting shots in arms to people. Now, some thought is that this will happen around Christmas time, others that it'll happen by the end of the year. Most people are thinking that by the end of this year, within the next couple of weeks, people will start getting shots in arms. And again, remember, it's those people, healthcare workers and long-term care facility workers, that will be getting it. That distribution is becoming a bit of an issue because the Pfizer vaccine needs that ultra-cold storage. That's minus 70 degrees centigrade. And those are freezers that are very expensive, tens of thousands of dollars, that some communities, some hospitals can't afford. And so distribution with the Pfizer is going to be a little tricky. With Moderna, their vaccine can actually last for 30 days at regular refrigerated temperatures like you have in your own household, and so that's going to certainly help with their distribution, but they're about a week behind Pfizer. Now, you may have heard about the Oxford AstraZeneca vaccine that's made out of the UK and how the UK approved that one already. Well, and they also approved the Pfizer vaccine. Sorry, they approved the Pfizer vaccine, which puts more effort here, or puts basically more of a force here to try and get the FDA to approve. So they have more pressure on them right now to approve it. But a couple of differences. The UK approved it early. The UK typically uses manufacturers' data and manufacturers' interpretation of the data. The FDA here in the United States wants the raw data themselves, and they want to do their own interpretation. And that takes longer. And that's why you're seeing the differences in the two. For the most part, the FDA has had a very good track record of keeping us safe with medications and vaccines. Of course, there have been some issues over the years, rotavirus vaccine being the biggest example, but for the most part, they've done a very good job, and worldwide they're looked at as kind of the gold standard of approval processes. So again, by the end of the year, expect people to start getting shots in the arms of the vaccine, and then we'll go from there, and they'll start getting it to more and more people for the general public, probably around springtime, before most of us start getting this vaccine. And the reason this is important is because of the numbers we're seeing. And you might have seen over the past couple days, and this is the second headline, 200,000 plus cases a day, 203,000, 208,000 cases a day. These numbers are cropping up, and we're not even seeing a peak from Thanksgiving travel. Thanksgiving travel, that peak, and remember, 6 million people travel over Thanksgiving. That peak will be 2 weeks after Thanksgiving, so we're a week into that now. So we still have another week to go before we actually start seeing a peak of that. Well, unfortunately, 2 weeks from now is also coincides with the beginning of December holiday travel, and so that's going to perpetuate it. And that's why you're seeing a lot of experts saying, a lot of public health officials saying, don't travel over December holidays, please, because we need to make sure we don't spread this. But a couple of numbers. Again, we're seeing over 200,000 cases a day. Some experts are saying that we could start seeing near 300,000 cases a day here before the end of the year or beginning of January. The deaths themselves, every day, unfortunately, we're breaking records. 2,777 deaths on Wednesday, 2,802 deaths on Thursday, yesterday. So these numbers keep going high. And if you remember me saying a few weeks ago, usually when cases happen, here's the way things work. It's all 2-week increments for the most part. So people get infected. 2 weeks later, they end up as a case. 2 weeks after that, they end up hospitalized if they're going to be hospitalized. And 2 weeks after that, people start dying from the initial infections 6 weeks ago. And so we're at that stage now where these high numbers we're seeing are probably going to contribute to more hospitalizations and even more deaths. That's very concerning. So what can you do? It's the usual things we talk about. The 4 W's. Wear a mask, watch your distance, wash your hands, and windows. Open windows to ventilate if you can. And one more thing, don't travel over the holiday season. I know it's difficult, I know it's hard, but don't travel over the holiday season to help yourself and your community out. And then the third one I want to talk about are kids and what's going on with kids. So now kids, a couple of these different vaccines are testing on children or soon to test on children. Pfizer has basically pushed their testing down. All these ones have been testing on adults. Pfizer's pushed theirs down to the 12 to 17-year-old range. Nothing below 12 years old. Moderna said they're going to do the same thing. Yesterday, I had a discussion on my Doc to Doc series with Dr. Buddy Creech. He's an infectious disease doctor out of Vanderbilt, and he's part of their vaccine program, and he's actually a principal investigator for a few of these vaccines. And he said it's going to be a bit of an even more compressed timeline with children because we're seeing the adult safety, we're seeing the older children's safety, and so they can basically shorten that timeline for testing younger and younger children, but it's still going to be a while. So it's probably still going to be into the summer before the tests are complete and children are authorized to get the vaccine. My question to him was, in the meantime, what can we do to keep our children safe? And his answer was interesting. The best thing you can do to keep children safe is to vaccinate the adults around them. Parents, teachers, caretakers, any of the adults around them need to have that COVID vaccine to protect the children. Even though we know children don't catch it as much, spread it as much, or get complications as much from it, they still catch it, they still spread it, and they still do get complications. So we need to protect them as well. Until the vaccines are authorized for them, that means protecting ourselves to protect them as well. So again, looking at the headlines, the vaccines, the race is heating up. Looks like in the next couple weeks, people will start getting shots in arms. Number two, the numbers, 200,000 cases a day, almost 3,000 deaths a day. We're getting higher and higher. Dr. Robert Redfield the other day said he thinks we might, by February, have 450,000 total deaths. Right now, we're at a little over 275,000 deaths here in the U.S. And so, that is definitely possible. I don't even know if that's the worst case scenario. I think it's kind of a middle road scenario. And so we definitely need to do these things to keep it under control. I know the vaccine, a lot of emphasis is being put on the vaccine. It's not here yet. Until it gets here, we need to do these protective measures. And even after it's here, probably still need to do protective measures for a while until we can get that herd immunity high enough. And that falls into that vaccine hesitancy issue. A lot of communities are basically doing a lot of cities are doing community work to try and get the vaccine down to the community level, try and get community leaders to understand and spread the word to get the vaccine. I'm working on a story in Denver where the public health officials there are working with community leaders, taking the vaccines to the communities, especially communities of color, because there has been some issues there of them with vaccination rates for the flu, and the concern is the same thing will happen with COVID vaccine. and so they're trying to get it down there. And essentially what the thinking here is, instead of people having to go to the vaccine, they want the vaccine to go to the people, which will make it much more convenient, and have their own community leaders talk to them about how good the vaccine is and why it's needed, so that way they can go ahead and get their shots and help their own communities and themselves at the same time. Now, let me see if you have any questions.
Do we know of anyone who has died from these vaccines?
Anyone has died from these vaccines, and nobody has died from these vaccines in any of the human trials that have happened so far. There have been, if you remember, about a month and a half, 2 months ago, there was a pause and a hold on a couple of vaccines. The AstraZeneca vaccine had a hold on it. A hold is an FDA officiated. We're seeing some data that's concerning. We're seeing some an adverse event, maybe more, that are concerning, so you need to hold it. This is an official thing. A pause is a company initiated. We're seeing some data out there. We're seeing some adverse events. We want to make sure those adverse events, adverse reactions are not related to the vaccine, so we're going to voluntarily stop it for a while. The pause itself in the company was only a few days. The hold was longer because it took more time to filter that through. Still not exactly sure on the hold and what happened there, but they think that it might be vaccine related, maybe not. This is the AstraZeneca vaccine. But the pause on the vaccine here, it turns out that the adverse events were in people that had not gotten the vaccine. They had gotten the placebo, so it was not vaccine related. And so as of now, again, no deaths from the vaccine. Now, the thing you have to realize is anytime it comes to any medication, anytime it comes to any shot, anytime it comes to any supplement, any herb, anything you take, there are potential side effects to these things. None of these are without side effects, but the side effects are usually minor. In these vaccines, Pfizer and Moderna, what they found is around 10% people had these side effects. They were not significant. They were essentially things you think that you typically get with a vaccine. If you've had a flu vaccine, you probably felt a few of these. Feel a little under the weather, maybe have low-grade fevers, get some arm soreness and some arm redness, maybe some muscle aches, and just don't feel good for a few days. With these ones in particular, the interesting thing is all the side effects cleared within a day and a half. And they had no serious adverse events, which is important to understand. Those side effects I'm talking about, again, low-grade fevers, body aches, headaches, fatigue, arm soreness and redness, those are usually a result of your immune system revving up to fight the virus. And so if your immune system revs up, it's going to put an inflammatory process in your body, and that's going to cause you some of these symptoms. And this is not necessarily the actual issue itself with the virus or the vaccine, it's your body reacting to it. So again, seems to be a very, very safe vaccine, and so we'll know more over the next couple weeks what's going on and how that's working as far as the distribution, but they're working on that right now. And again, for most of us, probably won't be getting it till the springtime. For the phase 1A, which are the healthcare workers and those in long-term care facilities, probably start to get it by the end of the year. Both of these are 2-dose vaccines, so it's going to take a little while to get people vaccinated by both doses because it's either 3 or 4 weeks separation between the dosing. But the good part is, I think we're starting to see, as Churchill once said, the end of the beginning here at this point. We're starting to see the fact that this vaccine can help us get through the pandemic, but we still need to do those 4 W's: wear a mask, wash your hands, watch your distance, and open windows to keep us under control. So again, thank you very much. I appreciate it. I hope you have a wonderful weekend. And as always, I hope you stay as happy and as healthy as you can.